A scathing report by the Auditor General puts Ontario's COVID-19 vaccine rollout under the microscope. It found there were millions of wasted doses, some hotspot neighborhoods were overlooked, and the province had a disorganized booking system.
The government fell down. They should have done better. It was a poorly organized rollout.
The overall COVID-19 vaccine wastage in Ontario is 9%, or 3.4 million doses. And according to the report, one private company wasted 57% of its supply. Auditor General Bonnie Lysyk also identified issues with the appointment booking system.
Vaccine distribution was not always equitable.
She says while the province created its own vaccine portal, there were multiple booking systems, with about half of public health units, many pharmacies, hospitals, and private companies using their own methods. And this encouraged vaccine shopping. There were almost 230,000 no-show appointments that also contributed to wasted doses. The audit also found that doctors were paid 5 times more than nurses and pharmacists to administer shots at the vaccination clinics, something the official opposition calls unfair and unacceptable.
That can tell you how the nurses feel. They feel completely devalued. That the work that they have been doing, the good work that they have been doing for a very long time in Ontario, is not being appreciated by this government.
About $18.7 million was paid out to private companies for underutilized COVID-19 testing. The audit identified 105 instances representing $800,000 in which vendors got their guaranteed minimum daily payment despite testing no one that day.
I think from an audit perspective, we would say there isn't value for money because, money was paid for services that weren't delivered.
And as the initial limited shipments of vaccine were touching down in Ontario, the audit found the province's hotspot strategy was not consistent across all postal code regions, resulting in 8 lower-risk neighborhoods receiving doses first and 9 high-risk neighborhoods being excluded.
I will not apologize for our vaccine rollout. We have a lot to be proud of, and the numbers prove that out.
Ontario's Health Minister Sylvia Jones, who led the vaccine rollout as Solicitor General back in 2021, is defending the government's pandemic response.
Everything that we did was all about speed and getting those vaccines available to people as quickly as possible.
The report also found that limited supply of rapid antigen tests that went to workplaces ahead of schools and childcare settings were not consistently monitored to ensure fair and equitable distribution.